Hello friends, good morning. My name is Pawan Sharma and I'm a pediatrician. Welcome to Pediatric Basics, basically our discussion forum for various pediatric conditions. Let us talk a little bit about congenital heart diseases. They are one of the most common malformation of all the malformations. I've tried to divide this into different parts so that it helps us in understanding better and applying it to our own practice. In day-to-day practice, we are likely to face a different clinical situation. As an example, just to mention few of them here, a term baby who has had a normal baby check has been discharged home, being brought to accidental emergency in a shock state. Then you have a term baby who's being seen on the postnatal ward and noticed to be completely cyanosed but otherwise well. And then you have a different situation where a few weeks old baby is brought to hospital with recurrent chest infection, concern about weight gain and not feeding properly, having some breathing difficulty. And at times you'll get a referral from a primary care center where the respective person is worried about that they have noticed a heart murmur in this baby. Okay, I'm just trying to be a little bit silly here, trying to explain you all the normal heart and its circulation, but believe me, it definitely helps in the understanding of the pathophysiology of the various cardiovascular problems. We do have two atrium, right and left, two ventricles, right and left, and two major blood vessels, the pulmonary artery and aorta, and then two major vessels bringing blood from different parts of body, which is superior vena cava and inferior vena cava. As you can see in the picture, the blue lines, they indicate the deoxygenated blood brought from different parts of body to right atrium. From there it goes into the right ventricle via the tricuspid wall, and then it gets pumped into the lungs via pulmonary artery, basically for oxygenation. And the oxygenated blood is brought back to the left atrium, from where it goes into the left ventricle via the mitral wall and then gets pumped into the systemic circulation. Fetal circulation. Some understanding of fetal circulation is really important to understand the basic pathophysiology of some of the congenital cardiac lesions. Now, as you can see in the picture, there is a placenta which is a main source for the supply of nutrition, respiration. Practically it works as a different organ for the fetus, like lungs, kidneys, liver and gut. The placenta is, as we all know, connected to the fetus by umbilical cord. It has got three blood vessels. The two of them, they are umbilical arteries, and then one is umbilical vein. Now what happens further, I have tried to divide into three different pictures to help us to understand what exactly happens. The umbilical vein brings the relatively oxygenated blood and nutrition from placenta to the baby, and it passes through the liver. It basically supplies 50% of that blood to the liver and 50% of it goes into the inferior vena cava. Now let us go to the second part, and it's quite interesting. So the blood from inferior vena cava goes into the right atrium, but preferentially it goes through foramen oval to the left atrium. From left atrium the blood goes into the left ventricle, from where it is pumped into the systemic circulation. And very interestingly, this particular blood circulation goes to the upper part of the body. Now the third part, so this is again interesting, isn't it? So the superior vena cava brings the blood to the right atrium, where this preferentially goes to the right ventricle and it gets pumped into the pulmonary vasculature through the pulmonary artery, the lungs receive only 10% of this blood, and the rest of the blood goes into the systemic circulation via the patent ductus arteriosus and supplies the lower part of the body. Now the changes happening to the circulation of baby as soon as the baby is born. As we know that the baby's birth cuts it off from the mother, so placenta is detached and the cord is clamped. The baby takes the first breath. As soon as the baby takes the first breath, there is significant reduction in the pulmonary vascular resistance, and the pulmonary blood circulation increases drastically. The lungs, they start working, and the oxygenated blood starts going to the left side of the heart, so that is left atrium, left ventricular ventricles, and then into circulation. The patent ductus arteriosus, the foramen ovale, and ductus venosus practically are not needed, and that's why they get closed in a different ways. So there is a vasoconstrictions of the patent ductus, the foramen ovale flap is closed, and the ductus venosus get constricted, and there is a reversal of blood supply which was happening in a fetal period. Keeping things basic, simple and systematic, you will probably get bored of listening to me again and again about this. Anyway, classification of heart diseases in children. So you can divide them into congenital heart diseases and acquired heart diseases. Congenital heart diseases can be divided into acyanotic congenital heart diseases or cyanotic congenital heart diseases. So within the acyanotic congenital heart diseases, as you can see in this particular picture, there is atrial septal defect, ventricular septal defect, and patent ductus arteriosus. So all this, they are left to right shunt because of the pressure difference between the left side of the heart and the right side of the heart. Apart from the left to right shunt, which I just mentioned, there are other acyanotic congenital heart conditions. Valvular heart diseases, it can happen to any of the valves, but the common ones are the aortic and the pulmonary valve lesions like aortic stenosis and pulmonary stenosis. Then cardiomyopathies, pericardial diseases, and arrhythmias. Cyanotic heart diseases or cyanotic congenital heart diseases can be further divided into decreased pulmonary blood flow and increased pulmonary blood flow. As you can see, I have mentioned the examples there. Tetralogy of the fallot is the commonest one. Then you have pulmonary atresia, tricuspid atresia, and with the increased pulmonary blood flow, there is transposition of great arteries, total anomalous pulmonary venous connection, and truncus arteriosus. There are quite a few other, but I have not mentioned them here. The most common cyanotic congenital heart disease is fallot's tetralogy or tetralogy of fallot. There are 4 components to it. I'm trying to explain through the pictures which were very kindly done by my wife Jaya. 4 components. There is a ventricular hypertrophy on the right hand side, pulmonary stenosis, ventricular septal defect, and overriding arch of aorta. The overriding arch of aorta basically means the arch of aorta is sitting right on top of the ventricular septal defect, and that causes more mixing or deoxygenated blood circulation to systemic circulation. Ductus arteriosus, if it is patent in otherwise normal heart, it will be a problem because that will be a left to right shunt causing overload over the heart. But there are certain cardiac conditions, as you can see on the slide, where you need presence of ductus arteriosus for life, and we have to even use medication to keep it open, and sometimes even do what we call as balloon atrial septostomy for survival of these babies. Patent ductus arteriosus is vital for survival in certain heart condition, that is the duct dependent lesions. Apart from that, the key thing is simple anatomy and physiology is always helpful in the understanding of the heart diseases. Now, the scenarios I mentioned at the beginning of the talk, I'll leave it here for now, but they will definitely come back with our further discussions in different parts on the congenital heart diseases. Thank you so much for listening and your valuable time. Wishing you all the best.